Sherry Waits, the CEO here at Cloud County Health Center, and I, we sat down and we talked about this a long time ago. And we put it into our strategic plan moving forward. We raised the priority. And that's basically it. You set your priorities and you know where you want to be a year from now. And we wanted to be on the forefront. We wanted people coming to us and asking us, how do you do this? Can you help us? Because it improves our image on many levels. And so that was basically it. We sat down, did the strategic plan. I made it a #1 priority. I've had a lot of help from the IT department, which is something that you do need. You need a good IT department to help implement this. Probably the biggest challenge was getting the word out there that this was something that could now be done, that just because we were in a rural community, it didn't mean that we didn't have the advantages of technology. Getting the word out there to the specialists to let them know that this was something that was actually available, because even though they may have known about telehealth, they thought, oh, this can only be in big cities, the larger hospitals, but technology is our friend. It has made it very, very available to us. The price is coming down. It used to be price prohibitive when it first came out, but technology advancing, it's becoming more and more available to other facilities, getting the word out to the specialists, and just helping them recognize that we can keep you from doing windshield time, from traveling to distant clinics. We can help you increase your patient base by providing a 15 or a 30-minute consultation via telehealth, and they can sit in their office. So the ones that are on board are, saying we would like to do more of this.
Okay.
I think that it's something that's probably the biggest thing, is getting the word out there and letting people know that you want to do it and that you're ready to make that step forward. A lot of good support from the providers here at the hospital, as well as the nursing staff, because some of these specialists will require us to send the nurses away for a couple of days or a week worth of training so that that provider feels comfortable. Some providers say, well, it's not my nurse, they're treating the patient. So if we send a nurse to them and say, okay, train this nurse, let them know what you expect from them, so that they can come back to our hospital and not only do their day-to-day routines, but when we have a patient that needs your services, we have somebody that you're familiar and comfortable with. I think 6 to 8 months is probably a reasonable estimation of what we went through. Other facilities, as they get on board, as long as they can get through the financial prospect, if they aren't lagged down with that, they could probably implement it in anywhere from 3 to 6 months. People are scared of the technology if they've not, put their fingers into it and said, this is how you do it. But the reality is a lot of it is you have to, of course, have policies and procedures if you're going to be working with Medicare, Medicaid. So that takes some time to develop, but there are tools out there and resources that you can use to develop models within your hospital. And if you are dealing with younger providers, they're usually really on board, because they're the ones that are tech savvy and they recognize this. If you have a more tenured provider that may be looking further into or possibly retiring or some such, then those are the ones that you go and say, look, this is new technology. It's just like you going and learning a new procedure, but it doesn't take that much to get your IT department involved in it. And myself, as well as my IT department, we've been very helpful with some other locations. We're actually, as I said, we're being called and asked, how do you do this? Where do we go? Who can we talk to? And that makes us feel good. That makes us feel like we are helping not just our local patients, but we're helping the healthcare industry in rural Kansas as well. Our providers at first their hesitation was, if we don't know who we're referring our patients to for specialists, we're not comfortable. So that's when we started bringing in some of these specialists to visit with our providers and say, we want to do this, what can we do for you? What do you want us to do so that we can set this up? And as soon as it was kind of like a domino or snowball effect, once we started showing our providers that we were able to get them in touch with the people that we're going to use for these specialties, then it made the game a whole lot easier.
Okay.
Because the provider, they feel responsible for the patient. If I'm going to refer you out to a specialist, I want to know that I'm referring you to a good specialist. It may seem a little overwhelming at first because you look at it as this tremendous program and all these things that you have to do, but really once you get the ball rolling, things start falling into place. It honestly does. And then once you actually get the program up and running, there's a tremendous feeling of satisfaction and accomplishment. We've got oncology, we have pediatric behavioral health, we've had dietary services come to us. We're working with allergists, rheumatologists, pulmonologists, spine specialists, endocrinologists. I mean, I have contact, if it's an ologist, I've contacted because I know there's no way that our hospital could support a staff like that, but I want to be able to provide any possible healthcare service that I can to my community.